Hey everybody, welcome back to Spill the Milk. I'm Nicki, registered nurse, board certified lactation consultant. I have a very special guest with me today. I've got Emily. She's a nurse practitioner who works with the pediatric population. And together we're going to dive into a topic that so many parents stress about, CMPA, or cow's milk protein allergy. And what happens when it's time to start dairy with your baby at 12 months. We're going to break this down in this episode. We're going to talk about what CMPA is and how it's defined, how many babies really have it versus how many babies just kind of get labeled with it, the symptoms, who can diagnose, and we're going to get into some lab values and things like that that Emily discussed with me that I absolutely found very intriguing. And then later, we're going to discuss the idea of where this you got to start cow's milk with your baby at 12 months actually came from, and how it's not maybe some magical requirement, how much dairy can actually lead to other issues with babies, and what alternatives parents can use. So, Emily, welcome. Thank you so much
Hi,
for
thank
joining
you for
me.
having me. I'm so excited. So, I'm Emily. I am a mom to an 8-month-old little boy. That's my first and most important job. But when I'm not, taking care of him, I am also a pediatric nurse practitioner. I have been a nurse practitioner for 3 years. And then even before that, I was a pediatric registered nurse from the start of my career about 11 years ago.
Ah,
So I'm excited to be here and excited to kind of talk about these topics.
and you work with really just the pediatric population, right?
Just the pediatric population, anywhere from infant to, sometimes up to like 21, 22-year olds, but mostly like infants to teenagers.
What I think is so important is that it's not just the pediatric population. You're working with their parents too.
Absolutely. And
You
that's
see
one of
the
the hardest
anxiety.
things
Yeah.
for sure. For
Yeah.
sure. A lot of anxiety, and being a mom myself, I've learned that side of things as well in the last few months. And, when we were talking, earlier, just kind of going through what this might look like, I had mentioned, I always said I would either be like a really anxious mom or I'd be like, you know, I'm not taking my kid until they're like very, very sick. And I definitely fall more on the anxious side. And so, I'm happy to, be able to come on here and help other moms hopefully not feel as anxious.
Ah, I love that. And I think it's important that people in the medical field, when they're dealing with pediatrics, it's not just like they got a baby in front of them. They've got the whole
Mhm.
group of people who are worried about the baby.
Mhm.
So, gosh,
Absolutely.
so much love for you for that because, right, you don't
Yeah.
just have one patient, you normally have a
Right.
few. So,
Right.
all right, let's get into CMPA. I'm so
Yeah.
excited for this. You actually, when we were talking, I was like, man, I knew some about it, but I didn't realize, like, I know there's this anxiety that comes in when we start seeing things that are scary, and how
Mhm.
the internet, the wonderful social
Mhm.
media aspect, can make this worse for moms. So, can you tell me what CMPA actually is?
Yeah, so CMPA is a cow's milk protein allergy, and you can kind of divide it up into two different kinds. There's, and there's a lot of medical nuance to this, but there's IgE and then there's non-IgE. And so I think what most people think about when they think of CMPA is the non-IgE CMPA that affects, more of like your gut. The IgE mediated CMPA, you're going to know your kid has it, right? They're going to have hives, trouble breathing, and that is not common. And really, neither is the other one, the non IgE CMPA, especially in breast milk babies, breast milk fed babies. And that's because when you think about how the baby gets the cow's milk protein allergy, breast milk's not made from what's in our stomach. It's made from what's in our blood. And so when a mom is taking in, dairy in her morning coffee or cereal or whatever, however you like to have your dairy, your body has to, use that and filter all of those nutrients that you're getting, and then it goes into the breast milk. And so when you think of it that way, I think it's like 0.5 to 1% of breastfed babies truly have a CMPA. And when you think about it that way, that's not very many. Which is reassuring because I definitely had those moments as a first time mom where you're seeing all these things, and even someone who has the knowledge, of what is normal and what is not normal, when you're seeing it for your own kid, you do second guess yourself. And so, I'm hoping today we can just talk a little bit about, these things are there, and CMPA is a very real diagnosis, but so much of what I see on social media and so much of what I found is that a lot of these things can just be normal newborn things. So,
Yeah. 0.5 to 1%.
yep,
That's all.
that's it.
Ugh. You know
That's it.
what, though? I think, and maybe correct me or tell me if you kind of agree, when you get into a chat room or you start scrolling social media about CMPA, it feels like everyone has
Oh,
it.
absolutely. I've fallen guilty to that as well. Even like I said, even as someone who has a, medical knowledge background, I find myself searching for answers when these things come up with my own kid. And I think it was really important for me to like take a step back and be like, what do I know is true? And
Mm,
for me, in nursing school and then nurse practitioner school, the most important thing that they teach us is mastering a normal physical exam, because unless you know normal, you will never know abnormal. And so I had to kind of ground myself and take myself back to, what do I know is normal? And when I think about it in that aspect, it really brought me a lot of, peace to know that all of these things that I'm worried about are probably okay.
so with that being said, what are some things that are normal that some people might think are CMPA?
Yeah, so one of the big things I saw when I myself was, scrolling through these chat rooms and Reddit and TikTok even, are the biggest one is rash, right?
Mhm.
Like my baby has this facial rash, and or a diaper rash, and neonatal acne is a big thing, and it's normal, really around that like 3 to 5 week time frame. Your baby has all of these hormones that when they were, in your belly and getting all of the nutrients from your blood through that placenta and the umbilical cord, they're getting all those hormones as well. And so just like when, you are going through periods of, hormonal changes postpartum, or when you're newly pregnant or that time of the month, all these hormone changes is what causes this acne that you get. And this happens for your baby as well. And so when they're, kind of clearing their body of all of these hormones they've been exposed to, the acne happens, and it can look, gnarly and scary and really red and angry. But if you just give it time, maybe 3 or 4 weeks and some breast milk, or, I love Tubby Todd, putting that just kind of healing, um, the breast milk with the healing properties and some moisturizer, that's going to resolve on its own. But what I also find is that that's about the time frame that if you were to eliminate dairy, you would expect to see results as well. And so I think a lot of people assume that when they see this rash, they see, these scary looking skin changes for their baby, and they immediately like, I've got to stop dairy. And they do, and they give it 3 weeks and things get better, and they automatically assume it was the dairy, when more than likely it was probably going to resolve on its own. Same with the
That's
diaper
huge.
rash.
Yeah,
Yeah.
that's like how you made that correlation. Some moms can't do that.
Hmm.
And you being able to talk somebody through that, that's super important.
Right. And even like, I mean, my little boy, he had horrible acne, and it is very distressing.
Mm.
You have this perfect little baby, and in a few weeks, and things are just changing for you, and then all of a sudden now your baby is changing. Their features are already changing. They're waking up. They're not quite this like sluggish little newborn that, that was so drowsy in the first few weeks. And then you see this rash. It's distressing, and just knowing that like it can be so normal, and it just can be a part of, of developmental, normal, then I think knowing that can be, hopefully help ease some anxiety for a lot of people.
What about babies? So I know there's several different conditions that can mimic, right, CMPA, but some of the big like CMPA things are
Hmm.
like, let's talk about blood in the stool. Let's talk about that
Yeah.
one because that one parents are like, there was blood in the stool, they have CMPA. Tell me a
Right.
little bit more about that, if you would, please.
Yeah, I mean, first and foremost, any blood in the stool should always be evaluated, right? Because it can be something severe, and if it goes on long enough, it can, lead to things like anemia. But in a child with CMPA, that blood is, even if you don't see it always, or it doesn't seem like a lot, those kids typically, it goes on for a while and they're ill appearing and they don't feel well and they're not growing and they're not gaining weight. So, if your baby is doing all of those things and they're, a happy kid, the first thought when you see blood in the stool, it doesn't always mean that there's, CMPA going on or cow's milk
Mhm.
protein allergy going on. Some things that can happen are like anal fissures in the first which is like a small tear just right at the opening of the bottom. And so, during those first few weeks of life, you have your meconium, and then you have a baby who poops feels like every 30 minutes, right? I feel
Yeah,
like I
yeah,
went through like 100 diapers a day in the beginning.
yeah.
And so that poop is acidic. They have fresh skin that has never been exposed to the world. And so then you can get some irritation when you're wiping all the time. And so you can get little tears that can cause blood in the stool. And also diaper rashes. If you have a pretty gnarly diaper rash with, skin that's broken down and really irritated, those diaper rashes can bleed. And so
And
sometimes it's
that's
not
not actually in the stool.
correct. It's just in the
In this,
diaper.
yeah.
Um, yeah. And so the other kind of thing I thought about even after, we had talked the other day was, especially, I feel like most people on this podcast are probably breastfeeding moms, but in those first couple weeks when you're learning latch and, there can be a lot of nipple trauma. And so
Mhm.
even like digested blood,
Mhm.
from, maybe you've got a cut on your nipple that's bled and your baby's taken in some of that, which is not harmful, by the way. You can absolutely
Right.
feed your baby if you've got if you're okay with it and the pain. But even ingesting some of that from, nipple trauma in that first, few days of breastfeeding can look like blood in the stool as well, or lead to some blood in the stool. And so I think distinguishing, is this a one-time event, or is this ongoing? Obviously, I think, if it's a one-time event, if it were me, I'd probably watch and wait. But of course, like I said, if your baby is like not feeding well, or they're irritable, or you can't console them, or they're not growing, or they're not feeding, obviously blood and stool needs to be evaluated. And usually we can, as a, nurse practitioner, we can check blood for blood in
Mhm.
the stool, and
Mhm.
we can make sure that, it resolves, and we can check them serially. So we may check and say, hey, this has blood in the stool. Whenever I order these tests, I'm usually ordering 3 in a row because
Okay.
I want to see it. One sample may have blood, but that doesn't mean every sample is going to, and vice
Mm.
versa. And so I think it's really important to follow up on that to make sure that it's an ongoing issue and that it wasn't just, a one-time thing from maybe ingesting some blood from nipple trauma, or, from an anal fissure, and making sure you have a good exam of that area as well. Because, if I see an anal fissure or a really bad diaper rash, I'm probably not going to be super worried about a one-time blood in the stool.
So, so tell me this. If I were to Google blood in stool newborn, what's going to pop up? What do you think's going to pop up? Because I know I know what I think is going to pop
Cow's
up.
milk protein allergy,
There it
right? Every time.
is.
Every
So
time.
what you're saying is so simply that it's not just one thing.
There's
It's a
many,
it's a
there's other things
it's a
that can
check
cause that.
mark process.
Right.
One thing
Right.
doesn't mean that. One thing
Mm-hmm.
could simply mean some little common issue because CMPA, as you said, 0.5 to 1%.
Mm-hmm.
So there is a 99% chance it's not CMPA because there's blood in the stool.
Correct. Correct.
Ah, the amount of relief I hope moms feel from hearing that.
Right.
Because you guys, it's so scary. But what
Mm-hmm.
about, okay, so this is the other question I have, right? Because again, I have a lot of moms who message me and they're like, I've removed all the dairy from my diet. I'm like, that was a really extreme thing to do. So, what if a mom says my baby isn't gaining weight very well and that matches CMPA? I know what I go to about weight gain, but does CMPA cause lack of weight gain as well?
It can, absolutely. These kids, if they're having, if it's severe enough, right? If that's truly what it is going to eventually lead to poor weight gain because of, there may be blood loss. If there's inflammation in the, intestines, then you're going to have, issues with um, absorption. And so that is going to lead to poor weight gain. But I think in a lot of the lives that I'm with, join everyone on, I think it's always important to distinguish like true poor weight gain versus like a perceived poor weight gain.
Hmm.
And again, following up on this weight gain, it, and again, is the baby happy? Is the baby healthy? Is the baby making wet and poopy diapers? There's just a lot more than just in medicine in general, it's never just, and I tell, families this all the time. They want to come to me and they want me to have an answer right away. And unfortunately, it's not always I can't say you have this, so it's definitely this, right?
Right.
You have blood in your stool, so you definitely have CMPA. It's a process and it's a work, it's called a workup for a reason, right? And
Workup.
so,
There's the
so,
word.
you know, yeah, making sure that, you have a proper workup. Because like I said, this is a very, it's a very real diagnosis, but it's not a common, it's not common, especially among breastfed babies. So,
Yeah. And I do hear a lot of moms say, well, my baby's not gaining weight well, and they're fussy, and there was blood in the stool. And I go to, as a lactation consultant, right? I'm board certified. I go to, is baby just having lack of exposure to breast? Like, are we just
mm,
not feeding that baby enough? Is that why there's a lack of weight gain? And again, blood in the stool can happen from so many different things. And yes, okay, two of the
mhm,
criteria are met, but what is the most common cause of lack of weight gain in babies, right? And I think it's
mhm,
important not to go to Z. It's to go to A, then B, then C.
mhm.
All
Right,
right, what else?
absolutely.
What else do you want to add about CMPA? Because this was so good.
So the other kind of things I think about, or the things that I saw myself when I was searching, or the things that I hear other people, worry about, are reflux. My
Mm.
baby has reflux. So I think they may, and I get this question a lot from like other, people in my life, or, have you noticed if your baby has any food sensitivities? And I think the biggest one is, reflux. And reflux is so normal in babies. It really is. And that's because the esophagus is a muscle. And so when you have this newborn baby, their muscle tone is not great, right? Just like
Mm.
everything else in their little body, they have to work and grow those muscles. And so that's why a newborn baby isn't born walking, right? Because the muscle
Oh,
tone is just not there. And
gosh.
so same, the esophagus is a muscle. And so at the end of the esophagus and right where you get to the stomach, which is also a muscle, there's something called the pylorus, and that muscle is super weak. And so when you're giving a baby, especially breast milk, which is super thin, it comes up really easy. And I don't know about you, but I have terrible reflux as an adult, and the worst position for me is laying flat. And what do babies do most of their life, first few weeks of life? They're laying flat. And so I think it's important to know that that is super common for babies to spit up, um and just knowing that they do grow out of it even as they start to sit up, that muscle gets stronger, you start introducing solids, that it most likely is going to get better. And we go back to, I think I've used this term on your lives before, a happy spitter,
Mm.
is what I like to refer to my son as, because, and it's a laundry problem in most cases. And there is, instances where it can lead to poor weight gain and a really fussy baby. And if you have those concerns, you should absolutely, talk to your doctor. But I think just hearing that babies spit up, and
Mm.
it's not always something to worry about, and most likely isn't something to worry about.
You know what? I love that you touched on that because I get those questions a lot. But I actually, as an
Mhm.
emergency room nurse, sometimes we get pediatricians who send babies in for quote caloric stenosis possibilities, and they want a visual. They want to see
Yeah.
this baby. They want it to be ruled out in the ER. And you know, when I sit with these moms, so I had one the other day. She's like, my baby's spitting up constantly. My pediatrician sent me here because they think it's pyloric stenosis. And And I was like, well, talk to me about your feeding. How's that going? Well, she had overactive letdown.
Mm. Mm-hmm.
So, yeah, her baby's going to be a spitter. But what I love
Mm-hmm.
so much is that, you know, sure, we can go to this whole entire other crazy place, or
Mm-hmm.
we could just watch a feed and see the
Mm-hmm.
baby gulping and
Sure.
knowing that what you said, and we even said this in our talk back and forth when you were like, breast milk is thin. And I was like, oh my gosh, it is thin. It probably does come up easier. It,
Mm-hmm.
again, I learned something new from somebody all the time. And I
Yeah.
appreciated that from you.
Yeah.
All right. What else?
Wait, one more
Yeah, no,
thing.
get
So
it.
we
I
kind
love
of
it.
just talked about overactive letdown, and so it kind of I had some notes here that I made, and the other thing that people love to associate with CMPA is mucus and stools. And for a breastfed baby, mucus in the stool is, normally not a cause for concern because of overactive letdown. If that baby is gulping, 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 and getting a lot of that formilk, those stools are going to be a little bit more mucusy probably than, towards the end of the day when your baby gets a lot of that high milk. And so recognizing that mucusy stools, are not always a cause for concern, or usually not a cause for concern, but also when your baby is sick. So we
Mhm.
are right on the cusp of respiratory season and flu season. And so when these babies get super duper snotty, you and we can cough it up, and we can get rid of our mucus, and we can blow our nose, and our babies can't. And so what do? They swallow the mucus. And where does that come out? In their poop. And so if your kid has a respiratory illness and, is not feeling well, if they've got mucusy poops, that's probably why.
Ah,
So,
gosh, dang, you covered so much. Thank
well,
you. I
I
think,
just, I think a lot of this, and, CMPA is not something that I deal with in my everyday practice, in my niche of what I do. It is definitely something that we see, but I think just being a new mom, a first time mom, and knowing what is out there on the internet and how scary that internet can be,
mhm,
and just hoping to bring a little bit of awareness that, like, it's not always the zebra. It it's mostly the horse, right?
mhm.
And so, of course, it is out there, and it's a very real thing. And but knowledge is power. Knowledge can also cause a lot of anxiety, but
Yep.
knowledge is power. And so knowing what can be so normal, and of course, if you have concerns, bringing those to, your primary care doctor, your pediatrician, but, also knowing that it they may say the same things I say, and tell you, it probably isn't that. And then just sometimes just give it time. And a lot of these things are likely to get better.
Well,
So,
thank you so much. So
of
now we're
course.
going to jump into the
Mhm.
next one because
This
when
one
I
is one
was,
I'm passionate about.
yes. And when I was on a live with you, you actually really kind of truly helped a mom. And I was like, this girl, I need her in my life. We need to have her in our corner. Because right, I already did this with my kids. I just didn't know people didn't know that. So we're going to
Hmm.
talk about, do you need to give your 12-month-old cow's milk? Do we need to?
Yes.
We're going to talk
So,
about
that's
where that idea came from. We're going to talk about
mhm.
how it's not some requirement. Too much dairy can lead to problems. And this is where you
Hmm.
really educated me because I didn't know some of this. So,
Hmm.
girl, let's talk about it.
Yeah, let's talk about it. So, I don't know what it is about 12 months, but that is when we decided that, kids don't need breast milk anymore, and we are going to change to cow's milk. And, cow's milk has its benefits, right? The most important thing for these kids is to have a well-rounded diet, and that does include dairy, for things like vitamin D and calcium for strong bones, but it doesn't have to be cow's milk, right? There are plenty of other sources of dairy, yogurt, cheese. And so I think where this came from a little bit was, I mean, I think it's always been a thing. I think a lot of, I know, like, my parents or maybe my grandparents really did believe that cow's milk was kind of this nutritionally complete option. And so transitioning these kids to something that's from something that's meant for babies to this cow's milk was something that needed to happen. And then you got in the 90s and their 2000s, you got your Got Milk campaign, which really
That's
pushed,
my era. I know what Got Milk campaign
yeah,
is. Yeah.
really pushed, for milk. And like I said, milk can be such a great resource, and can be part of a well-rounded diet. But what I find is that your baby has gone, my baby's still nursing probably 8 to 10 times a day at 8 months old. And so, when we get to 12 months old, we're thinking of cow's milk the way we think about breast milk and formula. And so these
Mm.
kids are getting 4, 5, 6 bottles of, 6 to 8 ounces of cow's milk a day, and it's just not necessary, right? Like I said, it has great fat, it has great calories, but it's not a necessity, especially if you have a kid who has a great, well-rounded diet. So,
So I kind of, when we were talking about this just before, I I'll tell a little bit of a story, just to relate it in that my first child, I weaned him at 12 months. I was a single mom, 20 years old, and I was happy to make it to a year. And I immediately went to cow's milk. Because again,
mhm,
in my family, right? I'm older than most of you. Okay, in my family, we had to drink milk. It was like you drank milk at every
mhm,
meal, and you finished your milk, whether it was warm or not. You sat there until your milk was gone. And so, in my generic mind, right, my uneducated mind, I'm like, oh, he's got to have dairy. There was an excess amount of dairy that led to colitis, like, and I didn't
mhm,
realize it was the multiple sippy cups of milk a day, because he was having that and not eating meals. Because if you think about
mhm,
it, you have a glass of milk, it fills you up. So then he wasn't
mhm,
eating his food, but he had colitis, he had lactose intolerance, he had all kinds of things. And so with my next one, I was like, I'm not doing that, because that was just like finding those disgusting sippy cups and all that stuff. And none of my other children had cow's milk. Their dairy needs,
mhm,
and I nursed them into toddlerhood. But, right? What if a mom's still breastfeeding after a year? Does she have to do dairy?
mhm. She
Right.
needs to do dairy, right? But maybe
Right.
not cow's milk,
Cow's.
right? And I feel like, I mean, cow's milk is, it's for whatever reason, it's so addictive to these young kids, right?
Mhm.
And I don't know if it, and we kind of talked a little bit about this, but I think it's the convenience, right? They can get full and they don't have to stop. Because I don't know
Mhm.
if you've been around a toddler recently, but they don't stop. And I would even say once they start moving, even if they're not a toddler per se, they don't move, they don't stop. There's no stopping them. They're busy. They want to play. They don't want to be interrupted for anything like lunch, breakfast, dinner. And so it's convenient for them to just
Mhm.
carry their cup and, they get their fill. But the issue is, and we can get a little bit scientific here, but when we think back to like middle school science, and you have your positively and negatively charged ions, and so calcium and iron are both positively charged, and so when you're giving your body, or you're giving your toddler's body, tons of iron, and tons of calcium, your body prefers the calcium for whatever reason, and so is going to take that iron and it's going to just not use it, and it's just going to get rid of it. And so um what we see, and kind of probably the most common thing I see in what I do, is iron deficiency anemia from cow's milk,
Oh
excessive
my
cow's milk
gosh.
intake.
I
So
had
that's why
no
I have
idea.
now become I'm not anti cow's milk, but I'm very much like, I want people to be informed and educated on, the pros and cons of giving and transitioning to cow's milk, but also to know, I hear a lot of parents who are very concerned and very worried and anxious that they can't get their kid to drink cow's milk, and what am I supposed to do? And my answer to that is don't worry about it. Because if they're getting their dairy and their calcium and other things like cheese, which I've never met, I've met very few toddlers who don't like cheese and yogurt. Then you don't have to give it. You don't have to even transition. You don't even have to try it. Um, but that it's just this addictive thing, right? I had
Mhm.
a family recently who told me their kid was helping themselves to the milk in the fridge, and I was like, oh my gosh. So normally, if cow's milk is something that you're passionate about, I usually recommend less than 16 ounces a day.
Okay.
And there's some people who may say upwards of like 20 to 24, but I think that we have to think of dairy as a whole. And so if your kid's getting dairy in other ways, then I usually say less than 16 ounces of cow's milk a day, because that's hopefully going to prevent us from spiraling into this we're not wanting to eat. So we're not getting iron in our diet anyways, but we're also giving our body so much calcium that we're not absorbing the iron. And so it can be a beneficial tool for maybe a kid who, doesn't gain weight, or a lot of, I think a lot of schools, daycares are, required to offer it. And so it's not inherently bad. I don't want that to be the message, that people get today. It's not inherently bad, but in everything, moderation is kind of key. But it's
That
absolutely not a necessity.
when we were talking prior again, you told me iron deficiency anemia, and I was like,
Hmm.
oh, I didn't even think about that. I just thought about how heavy milk
Hmm.
was in the gut and how it had to
Hmm.
rob, right, other nutrients being given because they're just not eating. They're just taking this,
Right.
drinking this milk. And so I didn't actually understand the true reason behind it. And I think that is going to give people so much more information for them to make a good decision for their family. And I think
Absolutely.
pros and cons in everything is important. You know,
Hmm.
with all of this comes you don't know what you don't know. But when you know it,
Hmm.
it's hard to not know it because it's so
Hmm.
impactful.
Right. And I
So,
hear that all the time, right? And what I do, I hear, when I'm telling families, hey, we really should be limiting milk to less than 16 ounces. And they're like, I had no idea.
mhm,
Um, I had no idea that, and it really can be such this spiral, right? Of they're drinking so much cow's milk that they're not eating. They're not getting the nutrients from other nutrient dense food like fruits and vegetables. And what they are getting as far as like iron goes and things that they eat with like meat and beans, they're not absorbing because they're getting so much calcium. But also, you think like you were telling me your child, had a lot of gut issues. And so it can lead to constipation and diarrhea, which also affects nutritional absorption. And so it's just this spiral, and it's just kind of a slippery slope. And so, again, knowledge is power. And I think you know, knowing information and being able to make an informed decision about what's best is super important, but also knowing that it's okay if your kid doesn't like milk. You don't have to stress about forcing milk um, into their diet. It doesn't have to be um, you know, a part of their diet at all.
well, and that even just goes back to just being an adult, right? I don't like milk. But
Right.
you see, I've got this sitting next to me. I don't drink milk,
Dairy.
but I find dairy in other ways.
Mhm.
They're not robots. Babies aren't and children aren't they're just miniature
Mhm.
adults. And we
Right.
just need to again that well-balanced nutrition. But this also goes back to the point of human milk is for human babies. And when we start
Hmm.
introducing things that aren't specifically made for babies, we need to be informed. And not every mom wants to nurse
Right.
past 2 months, let alone 2 years. So having this
True.
information is vital to surviving parenthood. And,
Hmm.
you know, you've taught me so much just in when you're joining my TikTok lives and you're in there, I'm like, oh, we've got a good one in here. Like, because you are speaking as a new mom, but you're also speaking
Hmm.
from that medical side of you where you can understand
Hmm.
why other moms are feeling like that and you see it every day in your
Right.
practice. Because again, you're not just treating a baby, you're treating a family.
Yeah.
So,
Right.
well,
And it's really
thank you.
therapeutic
Yeah.
for me too,
Yeah.
to be able to like, use my knowledge. And sometimes that is like brings me back and kind of reminds me like, you know, in taking care of my own kid, to go back to the things that I know and kind of ground me and know that like things are okay. You know,
Yeah.
they're not always Z. A lot of
Yeah.
times they're A and B. And so
Yes.
it's
Yes.
been real therapeutic for me too.
Do
So
you have anything else you want parents to know about any of this?
you've got you've got this, right? You can do this. Being a parent is the most rewarding thing in the entire world. And if you are searching for answers and you are worried about your kid, you're doing the best thing for them. And you're doing a great job, right? That shows that you care, and that's what that baby needs, is mom and dad who truly care about them and who truly love them. And if you care so much about them that you're coming to listen to this podcast, or you're, you know, searching Reddit, then that just shows that you truly do have their best interests at heart, and you've got this. So
Yeah. Ah, thank you again, Emily, so much for today.
yes,
You
thank you for
guys,
having me.
oh, you've just helped a whole bunch of, I know that a whole bunch of moms are going to learn something from you, and a whole bunch of parents are going to be like, I didn't know that. Thank you for sharing that with me. So, thanks again, Emily. I can't wait to see
Well,
all the
thank you for
comments we
having
get.
me.
Sure. Have a good one. Bye-bye.
All right, bye-bye.